Today's video is on Saxenda. Saxenda is a brand name for a weight loss medication called Liraglutide. Here are some things to know about this medication. Firstly, what is Saxenda? Saxenda is a prescription-only medication to help with weight loss. It's used in adults and in some cases in children. This drug has been increasingly on the news and has been described as a miracle weight loss drug, so lots of people are curious about it. Another drug you might have heard of is called Ozempic. These drugs were often first produced to help with blood sugar management and not necessarily weight loss. But we know that obesity is rising and is linked to lots of other health conditions such as diabetes and heart disease, and these medications are increasingly used to help with weight loss. It's usually used as part of an overall program to help with weight loss, including exercise and reducing calories. It's important to remember it's not suitable for everyone, and it can depend on your age, your health history, your other conditions and medications. Saxenda contains an active drug called Liraglutide, and this is an active drug ingredient which helps the medication work. It belongs to a group of drugs called GLP-1 agonists. This medication comes as a liquid and it's a pre-filled injection pen. This drug is based on hormones which are already inside our body naturally. Hormones are our body's messengers and help kick our cells into action. When we eat, lots of hormones are produced to help with digestion, and one of those hormones is called GLP-1. This hormone helps to tell us when we are full. This is what the order of amino acids that make up GLP-1 look like. And here you can see the order of amino acids that make up semaglutide. It has been made to mimic GLP-1. You have GLP-1 sensors all over the body, and once triggered, they have different functions. The GLP sensors are in places like your stomach, your brain, and your pancreas. Once these sensors in your stomach are triggered, it helps to slow gastric emptying, and so food does not move through your digestive system so quickly and you end up staying full for longer. There are also GLP-1 sensors in the brain, and once triggered, this helps to reduce hunger cravings. The GLP-1 medications like Ozempic and semaglutide help to amplify the natural hormones that your body produces. Saxenda is usually given by injection under your skin once a day, and your doctor will advise you on how to inject it. At this time, there are no generic forms of this drug available. So here are some things which are important to know. Saxenda is a prescription medication that's FDA approved for chronic weight management in adults with obesity and who are overweight with at least one weight-related health condition. This can include high blood pressure, high cholesterol, type 2 diabetes. Number 2, Saxenda works by mimicking the activity of a hormone called GLP-1. This regulates appetite and helps you to control your blood sugar levels. By reducing your appetite and promoting feelings of feeling full, it helps you to reduce your calorie intake and promote weight loss. Saxenda is a similar hormone to a hormone that naturally occurs in your body, which helps to control blood sugar levels, insulin levels, and digestion. It belongs to a group of medicines called glucagon-like peptide 1 agonists, GLP-1 agonists. Number 3, Saxenda is injected into your skin subcutaneously once daily, typically in your abdomen, thigh, or upper arm. The dose of Saxenda is gradually increased over the course of several weeks to minimize side effects. Number 4, side effects of Saxenda may include nausea, vomiting, diarrhea, constipation, abdominal pain, and having low levels of sugar, hypoglycemia. Saxenda may also increase the risk of possible other conditions including pancreatitis, possible links to thyroid cancer, and gallbladder problems. This is an important area to watch this space as new research is always emerging. Number 5, Saxenda is not a quick fix. It's important to remember to use Saxenda along with reduced calorie intake, increasing in exercise, and that's because you want to get the optimum benefits from this drug. Number 6, Saxenda is not recommended for use in pregnant or breastfeeding women or individuals with a history of thyroid cancer or pancreatitis. It should be used in caution with individuals with a history of depression or low mood. Saxenda and its side effects. Saxenda can have serious side effects and mild side effects. Here are some potential side effects that you might get. It's also important to keep in mind that the side effects you get can depend on your age, health conditions, and other medications that you're taking. Serious side effects of Saxenda may include acute pancreatitis, which is inflammation of your pancreas, acute gallbladder disease, such as gallstones, low blood sugar level, heart rate, which is faster than normal, kidney problems, such as new or worsening kidney failure, mood disorders. Saxenda may increase your risk of developing low mood or depression. Possible links to thyroid cancer. At the moment, it's not known if this drug causes thyroid cancer in humans, but in animal studies, Saxenda's active ingredient, Liraglutide, was found to increase thyroid tumors in animals. This is an important area to watch this space about as emerging research develops. And lastly, possible allergic reactions. Interactions between Saxenda and other medications. Well, there's certain medications, vaccines, foods, which may affect how this medication works. It's important to tell your doctor about other factors before they start you on this medication. It's important to know that you shouldn't be using Saxenda with other weight loss products such as Orlistat or green tea. Saxenda can also interact with other drugs, and that can include medication for diabetes such as insulin or medications. Important other factors to consider before you start using Saxenda include whether you have a history of kidney problems, liver problems, pancreatitis, type 2 diabetes, and depression. Saxenda and alcohol. Drinking alcohol during Saxenda treatment could worsen side effects that you might get with this medication, and these can include headaches, nausea, vomiting, diarrhea, upset stomachs, dizziness, and low blood sugar levels. If you're drinking alcohol, check with the doctor if it's safe for you to start Saxenda. Commonly asked questions include, will Saxenda work for me? Well, Saxenda will work for you depending on factors such as what are your weight loss goals, what is your current health status, and are you going to adhere to a healthy lifestyle? If you start to eat double and you don't exercise, then maybe Saxenda won't have the best results. It's important to combine all the different factors of weight loss together. Saxenda is not a magic pill, so you need to remember the other factors. Saxenda, which needles to use, and where is Saxenda injected? Saxenda is injected subcutaneously, which means it's injected to fatty tissue just below the skin. Sites for injection usually include the stomach area, the thigh, your upper arm. Saxenda comes as a pre-filled multi-dose pen device. Every time you're using the Saxenda pen, you take the device, you screw on the needle, you dispose of the needle, and you put a new needle on every time. We normally need a thin 32 gauge needle, which is provided for you, and that's because it's designed to be very thin, cause minimum pain and discomfort during injection. My top tips are, it's important to keep the skin clean before you inject, and it's also important to have a safety device and a disposable needles container to make sure you dispose of needles in a safe way, especially if you have children. Saxenda and breastfeeding. Saxenda is not safe to use during pregnancy, and that's because weight loss during pregnancy can harm a developing baby. If you become pregnant during use of Saxenda, speak to your doctor urgently. What is the difference between Saxenda and Ozempic? Saxenda and Ozempic are both medications used to treat obesity, but they belong to different classes of drugs and they work in different ways. While Saxenda and Ozempic are both GLP-1 receptor agonists, Saxenda is primarily used for chronic weight management in people with obesity, whereas Ozempic is used for type 2 diabetes and obesity, specifically with certain BMI criteria, like having a BMI of around 30 or 27, so it has different criteria. The dosing schedule is also different. Saxenda is a daily injection, and Ozempic is typically administered once a week. The summary is, weight loss is complex. Speak to your doctor for further advice. Remember that you're going to have to combine your lifestyle, your calorie intake, along with the use of this drug. There can be serious risks if you don't use it appropriately, and it's important to remember to speak to a doctor if you're concerned. Thank you for watching.